Hello. Good morning, Dr. S Ranjan.
Good morning, madam. Good morning, Dr. Ratna. Good morning.
Hearty welcome to RVC channel. Very happy to receive you. And today's topic is also very good. Healthy heart, because September was a month for the heart. Okay. And your achievements is so many, because so many years you have done. And the service is not ordinary. It is servicing the engine of the body, that is the heart. We as doctors are doing to the society, okay, and we feel it our social service actually. And so you are MBBS, after MBBS in MMC Chennai, then MD in cardiology, then DM specialization. And that is not all the thing. How many years of service you have given to these emergency patients? And I also want to hear you, because I am your student. Okay. So I was very happy that you have taken up healthy heart.
We are students,
Yeah.
because we are teaching each other right from the beginning.
Yeah. DXN has come
and
in.
the professor also.
Yeah. Okay. And I'm very happy to invite you to DXN RVC channel to enlighten our members who have taken the great strain of attending to this all the time, made it a point to be free in this time. And they are I request you to highlight them. It is a must that you must take care of the health, then everything will be taken care of. Health is the engine of our body. And that's so in China and Japan, because of Ganodharma, people live long, because of it is a tonic for the heart. And it controls the fat, blood circulation, nutrition supply, everything. You are going to talk, I know. Okay, doctor, now it is time for us to invite you, and all the people are waiting to deliver your precious lecture and new ideas and new information. That is very important. Every day new information is coming because of experience. And we really enjoy your teachings. Okay, you are Mahaguru. For gurus, you are guru. Now let us invite Dr. S Ranjan, cardiologist to President of India, and he has done his duty very properly and painstaking, at the cost of his health also. That we should appreciate, because when we are all right, we don't feel it. When we have some aging problem, and we feel it actually, but without winking the eyes. So all the doctors above 70, they are doing service, and the DXN has given products to your hands. Please select the products for your care, body care, especially in this corona period. That is very, very important. Okay. Welcome, doctor. I welcome you.
Thank you, doctor. Thanks for the nice introduction. It's my pleasure. And today we shall share about some of the products which are going to help our heart to have a healthy heart. So, as you rightly mentioned, Dr. Ratna, DXN products are very beneficial to the entire body, and especially some of the products are very essential for a healthy heart. All of us know that heart is a very precious organ. We always call certain organs as precious: the brain, the kidney, the liver, the lungs, and the heart. So having a healthy heart is very, very important. As all of you know, heart disease is the number one cause of death on the planet. It may be due to very many causes, but unfortunately, what is happening is we see a lot of young patients dying of heart disease in the past 10 to 20 years. That is very, very disturbing. We talk about the risk factors for heart disease, like smoking, diabetes, high blood pressure, obesity. And to this, the air pollution also contributes to the heart disease. Now, before going into the subject proper about the Ganodharma and the heart, I shall first narrate about the heart, why it is so special, and something very unique about the heart when compared to other organs. Heart is a very powerful fibromuscular pump, and it is made of muscles as well as fibrous tissue, so that it is empowered to pump the blood throughout the body, which runs into so many thousands of kilometers. Actually, it is said that our vascular system is around 98,000 kilometers. So throughout the entire the blood vessels, the heart has to move the blood. So it's a very powerful pump. At the same time, we should also understand that it's an emotional pump, because heart is the only organ which reacts to emotions like anger, stress, sadness, happiness, whatever it is, our emotions, it can affect the heart. And in my opinion, the anger is the worst emotion that we can have. So, because the anger can instantaneously kill a person, it can endanger life, because it is it causes great insult to the heart. And we have seen in our everyday life people dying suddenly when they become emotional. Something unique about heart is that it beats about 3 billion times, that is around 300 crores in a lifetime. Say approximately, if we take our lifetime as 70 years, it's about 3 billion times it is able to work without any rest. And it circulates the blood, as I mentioned, 90,000 kilometers of the blood vessels, the blood flowing through the such a vast amount of the blood vessels, the network of blood vessels. The normal heart rate is said to be around 60 to 100 beats per minute. Blood is very vital for life, because blood delivers oxygen as well as nutrition to the entire body, all the cells in our body. So many trillion cells, about 37 trillion cells or 50 trillion cells. All the cells in our body, they require oxygen as well as nutrition. So it is important for us to remember that blood is very, very important to transport these two vital nutrients to every cell in the body. And our health is primarily dependent on good blood circulation, both in macro as well as in micro circulation. Macro means bigger blood vessels, and micro means very small blood vessels, which are 1/100th of the thickness of the hair. So the heart has to pump such an throughout the body, it has to pump blood to the entire vascular system. So the vascular system is also very critical for the blood flow to happen. And if there are any blocks in the blood vessels also, that is manifested as very, very many disease conditions. As I mentioned, heart is an important organ in our body, unique organ. And we said that it pumps blood through the entire body. At the same time, it is equally important that heart also must get proper oxygen and nutrition. That is extremely important. So when nutrition and oxygen supply are decreased to the heart, then the heart starts failing, or many of the heart conditions can happen. So it is a complex anatomical structure. And if we talk about the blood vessels which are attached to the heart, so that how complex it is. And apart from this complicated the anatomical structure, we also have the special structure in the heart, which is called as the electrical system of the heart. So generally we talk about the blocking of the coronary arteries, that is the deposition of the cholesterol inside the heart vessels. I have shown it here that the cholesterol being deposited, it's a bad cholesterol, the LDL cholesterol that narrows the blood vessels, and this ultimately leads to reduction of blood supply and leads to angina pectoris, that is the pain, chest pain on exertion, and goes on to that leads to heart attack. So it's something governed by the aging process. Of course, we have risk factors. Then the tendency to develop the heart disease in a younger age is very, very common. That is why we see heart attacks and heart diseases so much. It's very common in the young age nowadays. So of all the deaths, cardiovascular disease takes around 31% of the total deaths all over in the world. That's a big number. So we should be extremely careful so that we should control the risk factors and take care of our heart. And talking about the risk factors, especially in the young people, it's due to high blood pressure, undetected high blood pressure, high cholesterol, then becoming a diabetic and young aging. And one other important factor is smoking. Even passive smoking is very, very injurious. And as I mentioned, the nutrition, improper diet, the malnutrition can lead to very many conditions affecting the heart failure, and obesity. And we find a lot of obese people nowadays. And there are so many studies, especially in the school children. And these studies show that at least 20 to 30% of the children, school-going children, are overweight. So the plaquing happens because of the aging process. So I always say aging leads to disease and aging leads to death. So the thickening of the arteries, which is called as atherosclerosis, where normally there is a cholesterol deposition, and this is an aging process, and this is triggered or hastened by various parameters like risk factors. Normally what we talk about, the high cholesterol, obesity, high blood pressure, smoking, so all stress. So all these factors will aggravate the deposition of bad cholesterol, that is an oxidized LDL, in the coronary arteries, and that is expressed as the blockages happening in the blood vessels of the heart, and that can lead to heart disease. So when we talk about the heart disease, not only the blood vessels can be affected, the heart muscles also can become weak, and the pumping function of the heart can be affected. We call it as a cardiomyopathy. The valves, I mentioned there are 4 valves in the heart, and these valves also can be affected, especially due to the aging process, or by some infection, or what is common in the third world countries, the rheumatic fever. I also mentioned that the conduction system is very important. If there is any problem or disease problem in the conduction system, either in the SA node, the pacemaker of the heart, or in the conduction system, it can lead to various forms of arrhythmia, irregularity of the heart. That also can become a very concerning problem, and we need to treat those conditions. The electrical instability of the heart, or when the heart becomes highly irregular. There are certain symptoms where if one gets a heart attack, It can classically produce a chest pain in the middle of the chest. It can also cause lightheadedness, nausea, vomiting, and rapid heartbeat, shortness of breath. You may feel very tired. So many sweating. So because of the sympathetic activation. So these are the classical symptoms. But what is disturbing is that, without these warning symptoms also one can get heart attack. Actually, 25% of the people without any warning symptoms, they get the heart attack, and many of them die instantaneously. So defining the heart attack, when there is a 100% block in the blood vessels, then the portion of the heart muscle dies, and that leads to the damages of the ventricle, and this leads to either electrical instability, or it can lead to the heart failure. So again, talking about the risk factors, it's a high cholesterol we talk about, even though today there is a controversy about the high cholesterol, but we are giving these statins so that we keep the cholesterol under control. The high blood pressure, especially in the young people, high blood pressure, smoking, and stress. These are the three major risk factors for heart disease. And added to that, long-term diabetes also can affect the heart. It can affect the heart muscle, the diabetic cardiomyopathy, the muscles can become weak, and also it can lead to occlusions in that is a cholesterol deposition in the blood vessel, the heart, and lead to heart attack. It's very disturbing to note that 1 billion people will die of heart disease in the 21st century. Out of 7 billion, 1 billion will die by 21st century. Of course, our population is also going to increase, and more importantly, the disturbing feature is that more of young people are going to die of heart disease. So it's extremely important that we should, right time, concentrate on the heart, and to have a healthy heart. The prevention is better than cure. And with the reference to DXN, we have a very powerful product, Ganodharma lucidum, which is a very powerful heart tonic. And we have been using it for quite some time now. And in the traditional Chinese medicine, it is a very powerful heart tonic. And initially, I took some time to educate you about the heart, how heart anatomy is important. Understanding the heart anatomy is important. The function is very important, and what are the treatment modalities available. But the best thing is, the prevention. Prevention is better than cure. And if you consume Ganodharma, it is going to protect the heart. All of you know better than me about Ganodharma lucidum. It contains more than 400 ingredients, and these 400 ingredients are classified into adenosine, ganoderic acids, triterpenes, polysaccharides, and organic germanium. One of the important action of Ganodharma as a powerful antioxidant. It's one of the powerful antioxidants which can detoxify our body from these free radicals. The free radicals are very toxic substances which convert the LDL to a bad cholesterol, oxidized LDL, which gets deposited in the blood vessels and creates blocks. And Ganodharma is the most powerful antioxidant known to us. So when you consume Ganodharma on a daily basis, you can protect your heart. Not only that, as an antioxidant, it can also prevent diseases like cancer and also arthritis and other brain disorders which are related to this free radical damage. So first and foremost, it's very important that Ganodharma can protect the body, protect our heart by its powerful antioxidant effect. So this I mentioned, the oxidized LDL is deposited in the blood vessel and create block, and Ganodharma is able to prevent that. And as an antioxidant, if you compare Ganodharma to ginseng, it is 5 times more potent like ginseng. So American Heart Association recommends regular intake of antioxidants. There are a lot of other antioxidants also. Spirulina also is an antioxidant, and we have a lot of products in DXN which are antioxidants, which are natural, and consuming these products, it can protect the heart. But this most powerful product is a Ganodharma, which can protect our heart by its antioxidant effect. Another important action of Ganodharma on the heart is, as I mentioned, the heart has to get a proper blood supply, especially the microcirculation. There are two components, powerful components present in Ganodharma, the adenosine and guanosine. They have the effect on the micro and the macro circulation, meaning that both the bigger blood vessels and these very small blood vessels, and only through the microcirculation you need to get the proper blood flow, the oxygen transfer, the nutrition, everything has to take place in and out of the cell. So Ganodharma is so unique in that it has got a very high concentration of adenosine and guanosine. By improving the microcirculation and the macrocirculation, it can protect the heart. So it can help the heart to get a normal blood flow and protect the normal function of the heart. So blood flow is very, very critical. So blood flow usually comes down with an aging process. As you age, the blood circulation comes down. And to keep up the blood circulation, that is why we say that you have to walk for at least 30 minutes a day, so that your blood flow is adequate to every cell in the body, every tissue in the body, every organ in the body. So as you age, your blood circulation comes down. So it's extremely important that you should walk for 30 minutes. And when you consume Ganodharma, your blood circulation also protected, especially the microcirculation, because of the effect of adenosine and guanosine. And it has, in addition, Ganodharma has got an antiplatelet effect. That's an aspirin-like effect, which prevents clotting. That's an additional benefit. So a lot of researchers have documented that it's an antiplatelet. So that's one of the powerful effect of Ganodharma, the antiplatelet effect. So the third powerful effect of Ganodharma on the heart is that the ACE inhibiting effect. That is a angiotensin converting enzyme inhibiting effect. By this, we mean that the workload of the heart is decreased because of this ACE inhibiting effect. The lanosterine triterpenes, the ganodic acid fraction F, they have the highest effect of this ACE inhibition. It not only reduces the stress on the heart, reduces the workload on the heart, and reduces the blood pressure. We call it as an afterload reduction. That benefits the heart, and the heart has got less stress when you consume Ganodharma. This is our textbook of cardiology, Braunwald's textbook of cardiology. And then there is a chapter in that, chapter 51, which is about the complementary and alternative approaches to the management of patients with heart disease. We talk about the holistic medicine now. So we have to include not only the conventional mode of therapy, not only the allopathy, which is very powerful, but we also need to help a heart patient through the complementary and alternative approaches. And in this textbook, they mention about two the products. One is the green algae. What is green algae? Green algae is a spirulina, because spirulina is rich in nutrition. Whatever the cell requires in our body, all the 50 trillion cells. So the nutrition, there is very high nutrition in spirulina, and this nutrition, the vitamins, minerals, and trace elements, they give proper nutrition to the heart muscle cells so that they function normally. And they mentioned the Ganodharma lucidum. They talk about yoga, meditation, acupressure in this chapter, and it's very important to know that in our textbook of cardiology and allopathy, there is a mention about our products, both the spirulina and the Ganodharma lucidum, which can prevent heart disease and help heart patients. We talk about the cellular regeneration. That is a recent theory by which we are treating heart patients, heart failure patients, the regenerations of the cell can happen. You cut the nail, it grows. You cut the hair, it grows. You cut the liver, it grows. It has a capacity to regenerate. And like that, heart muscles also can regenerate. And that is one of the important properties of the heart muscle. And what Ganodharma does is that it can regenerate the heart. There are several toxins in the which can damage the heart. We need to be extremely careful. As I mentioned, these cigarettes, smoking cigarettes, it contains more than 6,000 chemicals. And the tip of the cigarette butt, it's around 900 degrees Celsius. And many of the components, the inhaled in the smoke, they are toxic to the heart. They can cause cancers and lead to heart attack. So smoking is very harmful to the heart. Even the passive smoking, and I've seen a lot of smokers. They smoke in front of their pregnant wives. It's extremely ridiculous. People don't realize that.
Going to be in
So I mentioned that about the high blood pressure, how it can lead to heart attack, high cholesterol, and the sugar also. The recommended sugar intake per day is about 5 grams, and invariably, whatever the soft drinks that we are taking, we are addicted to. They contain more than 30 to 35 grams of sugar. So kindly avoid sugar, and if you are able to use the natural sugar, it is fine. Even the sugar substitutes also, they are very bad. So when you talk about the prevention, we have to control all these risk factors: the diabetes, high blood cholesterol, high blood pressure, lack of physical activity, and obesity and smoking. And what is very important about this Ganodharma, unique about Ganodharma, is that it can cause cell regeneration. So your liver cells can grow, your heart cells can grow, and various tissue cells, they can grow. And ultimately, when you are aged, our cell population is kept constantly, and all the vital organs in the body they function normally. This is to show you how this ACE inhibiting effect can transform into benefit. That is, it can normalize the blood pressure, and also the ACE inhibition, as I mentioned, it can reduce the afterload, the stress on the heart. And we give a lot of drugs now which can act on this system, angiotensin 1 and angiotensin 2. They are called as ACE inhibitors, angiotensin converting enzyme inhibitors. There are so many pills, angiopril, lisinopril, perindopril. There are so many pills available. They act on is angiotensin 1. Now we have receptor blockers, actually blocking the angiotensin receptors. The angiotensin 2 is an active component, and there are so many drugs acting on this system. So Ganodharma is powerful in producing this physiological and biological effect of blocking this angiotensin, so that this ACE inhibiting effect can protect our heart, reduce the workload on the heart. So the another additional benefit of this ACE inhibition is the insulin sensitizer, whereby it can help the diabetic patients also. And it is an anti-inflammatory, Ganodharma lucidum. There are so many inflammatory conditions of the heart. It can lead to cardiomyopathy, the dilated heart, failing heart, so many autoimmune disorders. They are due to inflammation. And rheumatic heart disease, as I mentioned earlier, it's due to inflammation. So Ganodharma, being a very powerful anti-inflammatory agent, it can protect our heart from all these inflammatory conditions of the heart. So this anti-inflammatory property of the Ganodharma is generally said to be due to the polysaccharide fraction. So Ganodharma by preventing inflammation of the cells of the heart, it can protect the heart. And the Ganodharma can also prevent various infections because it's a very powerful bacterial and antiviral action, and also an immune modulator. It increases interleukin 1 and 2 and increases the immune system. So modulating the immune system, it can actually help in some of the conditions like rheumatic heart disease and rheumatoid heart disease and various other inflammatory disorders of the heart. It's a very powerful anti-stress herb. We discussed about that. Stress is a major killer. So generally, it affects the heart more than any other organ by increasing the blood pressure and the heart rate and stress on the heart. The increase the afterload of the heart, and then the catecholamines responsible for this bad effect. The effect of the stress on the autonomic nervous system can damage the heart. And by Ganodharma, by acting on the brain, it has got a very powerful effect of calming the mind, and the stress can be relieved and the heart can be protected. When we talk about the risk factors, we talk about the modifiable risk factors like high blood pressure, high sugar, cholesterol, triglyceride, obesity, lack of physical activity. All these are modifiable. You can change it. So by changing our daily habits and our daily food habits, especially the food habits and the nutrition. We also talk about the non-modifiable factors. The non-modifiable factors being the aging. Aging, actually, we don't have any control. And but the beauty of Ganodharma is that it's an anti-aging. Being a very powerful antioxidant, it has got anti-aging properties. So when you consume Ganodharma, you can also take care of the aging process. I always say aging leads to disease and aging leads to death. And Ganodharma being a very powerful anti-aging, it can protect the heart in the age-related illnesses. Actually, in the Western society, the age-related heart failure, heart rhythm abnormalities are very, very common, especially after the age of 80 years. And the government is spending a lot of money for taking care of these patients because they need to get admitted in and out of the hospital. There's a huge strain on the government, especially in the Western countries. So it's absolutely important that we should stay healthy and have a healthy heart. So aging heart, as I mentioned, it can lead to heart failure, various types of abnormal rhythms, the arrhythmias, and even though we have medications, very powerful medications, and we have the implantable cardiac defibrillators and pacemakers to control our rhythm, but it's wise, I think, we prevent such disorders. The regeneration, we talked about how powerful the Ganodharma is important to regenerate the cardiac muscle, also to regenerate the blood vessels, especially the microcirculation. We call it as a neovascularization. So that is one of the powerful effects of Ganodharma. And today we have a lot of drugs like statins, aspirins, antioxidants, and we should remember that Ganodharma is something like a poly pill, which has got all the benefits of statins, aspirin, and the antioxidant, especially in the area of prevention, as well as also it helps the heart patients. So we call this as a pleiotropic effects of the drug, or now we can say the Ganodharma, because it's beneficial to the heart in health as well as with the heart patients. So when you consume Ganodharma on a daily basis, we can prevent heart disease, we can help a lot of heart patients. The next product is a spirulina, and as I mentioned, heart should receive proper nutrition, all the micronutrients. So our spirulina is a world-class spirulina. We have all the standard ingredients in that. We have 65% digestible proteins, vitamins, minerals, and trace elements, because spirulina also is an antioxidant, meaning that it can protect our body can from the free radicals and also help in cardiac patients. So I have shown the documentation in my textbook of cardiology about Ganodharma as well as spirulina. So the green algae, nothing but spirulina, and one should consume our spirulina on a daily basis, at least 2 to 3 grams per day. That is around 6 to 10 capsules of spirulina every day, so that we can protect our heart. The other important product is that cordyceps. The cordyceps, it's supposed to help in protecting the heart as well as the vascular system. The vascular system is very, very critical. The blood flow has to happen both in the micro and the macro circulation. So cordyceps is especially very powerful in protecting the heart as well as the blood vessels. So we have cordyceps coffee. So kindly consume cordyceps coffee on a regular basis so that at least you are able to get some amount of cordyceps. I'm sure that once the Siddipet factory is open, we will get the cordyceps. And I've been repeatedly requesting the management to give us cordyceps and lion's mane. Lion's mane is very good for the nervous system. It improves the production of nerve growth factor, NGF. And apart from this, these benefits to the heart and the blood circulation, it can maintain our immune system, kidney function, liver function, and also maintain the cholesterol and regulate the hormones, especially in the ladies. So cordyceps is a very powerful product. So I want all of you to at least use cordyceps coffee on a regular basis so that you can protect your heart and have a healthy heart. This is one of the recent journals, the Indian Heart Journal, publication in 2018-2019, September 2018-2000, full article on Ganodharma lucidum. The role of polysaccharide peptide of Ganodharma lucidum as a potent antioxidant against atherosclerosis, meaning the blockages of the arteries, and in stable angiopathy, that is a heart patient. It's a full article. It's a 6-page article which has come in our Indian Heart Journal. So I have shared this on many occasions to our DXN family in my presentations as well as to many of my cardiologist friends. But most important thing is, we have to prevent heart disease. This is one of the books written by one of the very popular, well-known the cardiologist, Dean Ornish, Reversing Heart Disease. You can reverse the heart disease, healing the heart. And by healing the heart, I mean that through our diet, exercise, medications if necessary, and also taking our nutrition, DXN nutritional supplements, Ganodharma, spirulina, and cordyceps, especially these 3 products. It's possible to prevent heart disease. And bypass surgery has become a standard procedure now. But there are natural bypasses in the heart. God has given that the collateral vessels. So when you take certain drugs or these nutritional supplements, so collaterals can open up these minute vessels that can supply the heart and strengthen your heart. And Ganodharma is that. The latest techniques, the open heart surgery, I talked about various treatment modalities, very complicated surgeries, and they are for mainly for children or adults who cannot be managed with the drugs alone. I'm quoting one of the great the cardiac surgeons in the 60s. He has done more than 150 heart transplant. He is the pioneer of heart transplant surgery. This Dr. Christian Bernard, he is from South Africa, and later in life he was unable to do cardiac surgery because of a disease called rheumatoid arthritis. And he is a pioneer of the heart transplant surgery. And now of course, even in our country, we do so many hundreds of thousands of heart transplants. It has become a standard procedure for failing heart, which cannot be helped with the drugs or any other modality of treatment. And to quote Christian Bernard, he said, "I have saved lives of 150 people by heart transplant. If I had focused on preventive medicine earlier, I might have saved 150 million people. That is a thing we are doing through DXN. We can prevent not only heart disease, we can prevent so many diseases due to aging process with through our powerful products, especially these three powerful products for the heart: the Ganodharma, the cordyceps, and the spirulina. So I want every one of you to think about it, how our heart is very, very important, very vital to our body and for our everyday life. And 29th September is celebrated as the World Heart Day. In my opinion, you can celebrate World Heart Day every day in a year. And if you want to protect your heart, you should consume our DXN products, these three products, so that the theme of use heart to beat heart disease. First of all, you should love your heart, and also you should have a healthy heart. Not only a healthy heart, but a noble heart to help people. That's very, very important. So DXN requires a noble heart. The nobility is very important. So when you get associated with the DXN, that means you are a noble person. You want to help somebody. So financially or health-wise. So that is what my experience in this 20 years of my journey in DXN. So at this juncture, I want to thank. I'm so grateful to my very close friend, my family friend, Professor Vaspalaya and Dr. Ratna for getting me involved in DXN. And I think in my opinion, my journey in DXN for the past 20 years have been very, very happy and enjoyable. And I'm every day I'm enjoying this journey in the DXN. And I want every one of you to enjoy this journey in DXN. For all this, we must be grateful to our CEO, our beloved CEO, Dr. Lim Sujan, for giving us this DXN to us. And also, we must thank Professor Vaspalaya and Dr. Ratna for bringing DXN to India and helping millions of people all over the world through RVC and the DXN system to help people to be healthy and wealthy. So thank you very much. And I thank the Professor Vaspalaya and Dr. Ratna for giving me this opportunity to talk to you today. Thanks a lot. Thanks a lot. Stay healthy, stay safe.